Well, let's begin. I'm here to answer any of your questions about the intensives and my experience, etc. So let's go ahead and start. What's your first question?
My first question is the difference between trauma and complex trauma.
Okay.
What's your experience
All right.
of those differences?
I'm going to think for this explanation about trauma as single incident trauma. That's where an individual has perhaps like been through a auto accident where they felt in danger or their lives felt threatened. They may have experienced a lot of shock and freeze as a result. And so they're experiencing symptoms of traumatic stress. And so those single incident traumas are very, very easily cleared. Remembering one brief example of a young teenager who was chased down by two dogs and had trouble getting back to school, had trouble getting up in the morning, sleeping at night, and we resolved that trauma in 3 to 5 sessions. Complex trauma is a series of trauma, think of it as chronic, over time. So it may begin in early life and then reinforce the negative views about the self, incapacity, feeling helpless, feeling powerless, threat, in danger, might be lifelong embedded feelings for the individual. And so that results in a number of repeated traumatic incidents that very often follow a theme line of a negative thought about the self. So I hope that answers your question.
Yeah, it does. Great. Thank you. Tell me a little bit about your training.
Okay, good. Well, actually, in 1980, I started in a volunteer program as a volunteer for a counseling center. That's way back. And then in the late 80s, I decided to take my doctorate, having heard my calling, and began my doctoral program. Then in studying and graduating with a degree in clinical psychology. So that's the PhD. So I've earned the right to be called a doctor, but then with every new client, it takes time to have them not call me doctor and just call me by Jordan. So
I am interested in what drew you to the intensive therapy model and what that model is.
Oh, okay. Yeah, well, I've been doing individual therapy since 1995 as a licensed psychologist. And the intensive model really helps break through the most difficult traumas that an individual faces in their lives. The big advantage that I find as a clinician is that I don't have these long spaces of time between meetings. With hourly clients that come in maybe once a week, maybe every other week, sometimes every 3 or 4 weeks, the psyche naturally begins to close up again because we can't have this on the surface all the time. We have to carry on with our lives. And so a lot of times the people who come in for an intensive have already been doing therapy for a number of years, and they're either stuck because the modalities that are being used, the methods that are being used have kind of played out for them, and they need a different approach. In the intensive, we don't have to have the every 50 minutes, every other week. How are you? How have your weeks been? And we go right into the trauma work with intensives consistently until we resolve the trauma that we're working with in that session. So it may take an hour and a half of concentrated work. But then I get to do a full 360 on the trauma. I don't have to break it up over several sessions, which has occurred many times in practice over the years. So from a results standpoint, both for the client and for me, it's very much more satisfying and results achievement. I guess that's a way to put it.
So it sounds really efficient, like the client can move through a lot of work very quickly.
Yes, well, it's the key things. We start out with what are the worst traumas that a person has been through over their lifetime, and we have an opportunity to weave that in with how do they want to feel? What do they want to achieve by the end of the intensive? Because we're talking about 30 hours in 5 days of really concentrated work. And it's hard work, but after every trauma resolution, let's say it's an incident that took place in college, disagreement with a fellow student, the examples could be endless. But at the end of the trauma session, I'd say an hour and a half of work, they come away with, oh, I ask them, okay, go back to the image we started with of that event. I can't see it. Or it's like looking at a ship on the horizon. I know it's a boat, but I can't tell you what kind of boat it is. The emotions, the sensations in the body are resolved. They're completed. So a lot of people like to say fixed or ask about fixing or cures, but I prefer the word resolution, because emotions are transitory. They move through us, but traumatization freezes them up, you might say. It locks them up, encodes them in the right hemisphere of the brain. And we need direct interventions like EMDR and image transformation to unlock them and let them go.
I'm wondering if you could tell me a little bit about what some of the people that have been through the retreats and have done EMDR, for example, how they talk about it after they've completed the process, or sort of the short-term results.
Mm-hmm. Well, I would go back to processing a particular memory or incident. It's very difficult to see it. They don't feel it anymore. It's pretty much neutralized. They're calm and relaxed. But after a series, for example, I'm thinking of one particular client for an intensive, she came away with, I feel like myself again. And another person said, I feel free. Just the other day, after an image transformation integration session, that she said, all that stuff that used to bother me about my parents, and I spent the whole weekend with them, all that stuff that really used to make me angry or irritate me, and I would respond with my own anger, none of that happened. It all changed. So the result was resolving the trauma. The trauma was no longer having its longer-term effect on her relationships with her parents, and incidentally with her sister and with friends and with her business associates, just from just that one session of release. In this case, it was childhood rage, which children don't often express. So that was a remarkable thing to hear from a client, that kind of big change that they experience in relationship internally and then outside with family and friends.
Can you talk a little bit about how the results hold long term? Have you had clients that you maybe a year or two down the road tell you how the results have lasted?
Oh, okay. So here's how I'd like to answer that question. First of all, the research, follow-up research, shows that with EMDR, images and memories are desensitized in follow-ups as long as 18 months. And if it's not going to come back in 18 months, it's not going to come back, is my experience with people. The operative question, I think, is not so much will it come back as did we get it all? Traumas often have different aspects to them, like facets on a gemstone. And with the intensives, and again, this is another advantage of the intensives, I get to check in with all aspects of the traumatization. So it's not only the negative belief that they have come away with after the trauma, like I'm in danger, I'm going to be abandoned again. So there's a negative belief that can result, but I can feel a lot of pain. or anger. I can have sensations in my body that I really need to get rid of. Many people don't realize that the sensations of shock and freeze that are often part of the traumatic incident build up in the body, and they stay there until they're released because they're survival oriented. The shock sensation, where a person would say, I can't believe my father, my mother, my boss would say that to me. And it halts the emotional processing for survival purposes of the self, okay? And then freeze, well, I will cite a personal example. I was in an auto accident one time where a person just turned right in front of me. And first it was shock for me because I was very stunned, but then I felt frozen. I had a real difficult time even moving. I was just trying to assess where I was, what had happened, and that's the kind of freeze response we can have in any kind of trauma, whether it's interpersonal, whether it's a natural kind of trauma like a major storm, hurricane example, that sort of thing. So again, I hope I answered that question for you.
So I've been in therapy for a while, and I was wondering about coordinating care with my therapist, and I also am wondering, I've done a lot of talk therapy with my therapist. I'm wondering how the intensive trauma work is different than talk therapy.
Okay. Well, first of all, actually, I'm ethically required to coordinate care. So if you decide to sign up for an intensive retreat, then I'd be asking you to sign a release for your therapist and me to be able to coordinate care and make sure, what I want to be sure is the work that I'm going to do is not going to mess up their treatment plan, and that's going to be a harmonious approach for the best result for you. The other thing is that just talk therapy is counterindicated long-term as the sole intervention for trauma. My experience has been that repeated talk therapy simply re-traumatizes the client and they never seem to get anywhere. Whereas directed trauma treatment, again, like EMDR, internal family systems, image transformation, really resolve the incident and it's done. We don't have to talk about it anymore. There is the necessity of a certain amount of interpersonal talking to find out what really are the key elements of the event that trouble the client. For example, trying to nail down the image that they carry in their mind of a traumatic moment, and they're running it like a film in their memory. And then what I try to do is find the worst moment for it, where the emotions have been peaked and then locked away in the unconscious. And I need to find out how a person thinks, works in the world, and how they put their life together and how they live their life. And that's a certain amount of just interpersonal relationship to be able to arrive at a determination of what the key issues are regarding the traumas and how it affects their lives.
So outside of speaking with my therapist, everything that we do during the week or the days that we spend together are confidential, is that right?
Yes, under the laws of the state of California, you have the right to a confidential relationship. There are legal exceptions, but we review those with the client when we determine to sign up for the intensive, but by and large, everything that is disclosed within the intensive is, under the laws of California, confidential.
And if I had a family member or my partner that I thought it might be helpful for them to understand what we're going to be doing, and I release you to speak with them, do you ever share in a helpful way with family members or partners?
I've not run into that in the time that I've been doing intensives. If it was really to the client's benefit to do that, I'd certainly be open to explore it with a client, but I've not had that experience.
You were just talking a few minutes ago a little bit about some of the modalities. And so I'm wondering briefly just a little bit more maybe about image transformation and some of the other types of therapy that you do besides EMDR for the trauma work, and maybe where I could find out more information, because I know we don't have time for you to go in detail through all of that.
Okay. All right. So let me break those down, the ones that I use typically. First of all, EMDR, the initials stand for eye movement desensitization and reprocessing. I know that can sound like a pretty cumbersome title, and even the original developer, Francine Shapiro, admitted one time as I was in conference with her, she wished she'd named it something else that was a little less awkward, but that's what she landed on: eye movement desensitization reprocessing. So the idea is that the eye movements acts back and forth, corner to corner, or tapping, what they call that bilateral stimulation, accesses the information processing system of the brain. So the neural activity in the corpus callosum, that's the bridge between the left and right hemisphere, goes way, way up. So it accesses those unconscious elements of the memory and integrates them with the ability to make sense of everything. Very effective treatment. It's well researched, been around a long time. I started my training back in 96 and 97, and it produces really good results. So it's a 7-phase process, but I won't go into long about that. But you can go to emdr.com, and you should be able to find a lot of information, and there's a lot of published works on EMDR. So if you want to read up on that.
And then other modalities, you alluded to, you use more than one. You do more than just EMDR. So can you tell me a little bit about the other?
Well, I've been using image transformation therapy for about 6-7 years, maybe a little bit longer. Memory fades on when I took my first training. The thing that I really value about image transformation, it's a very gentle breath and visualization technique. And when we ask about elements of the traumatized memory, for example, like I've alluded to, the image that a person carries in their conscious or unconscious mind of the memory, we ask them to lightly describe the image, and I will add 5 to 10 words. All I need to know what the key words are, so that if the client gets somehow distracted in the process, later in the protocols, they may ask me, what image are we working with? I will be able to say the key words, and that'll bring back what we were working with in the original image. And that's very helpful, because it doesn't re-traumatize the client in the retelling. We don't have to really get deeply into the emotion in order to release it. And that's incredibly valuable. Plus, there's a very nicely defined set of protocols that get to very specific disorders, not only depression and anxiety, obsessive compulsive disorder, social phobias, and the list could go on, but I won't take up your time with that. But if you have anything specific that you're concerned about, you should feel free to ask me.
Can you just tell me a little bit logistically about what the days would look like what time we would start, a little bit about the area where you're located, would I be able to have an area to go have breaks? Tell me what our days might look like. Sure.
Well, we're here in Auburn, California, right near downtown. We're about 2 blocks away from a host of very nice restaurants for lunch. We usually start out at 10 o'clock in the morning. We go for 3 hours. We break about every 50 minutes or so, 60 minutes, or as needed. And sometimes when we're processing, though, I will simply check with the client, can we keep going or do you need a break? So really it's pacing with my client that's really important about breaks. We take an hour for lunch, we come back for another 3 hours, and then we break for the evening. About 6 hours of intensive work is pretty heavy duty psychological work, and that seems to work pretty well for the clients.
Have all the people that have come to you for intensives been able to go all the way through the week, through the days that they intended, or have you had anybody that just kind of got too overwhelmed? And
no, fortunately not. Even when there's been some, psychologically speaking, heavy lifting of traumatic memories, the individual, well, here's an example. A client actually said to me, inquiring, well, okay, now that we've done our first day or our second day, how were you afterwards? I was so tired. I went home, I had a bite to eat and went to bed and slept the whole night long. And so they came back refreshed, but the work was very exhausting for them that day. One of the things that I think that's really notable, and this is kind of going back to one of your previous questions, is this particular client said, really wanted to accomplish a breakthrough in being in touch with his feelings and be able to communicate them with his wife. He got on the phone and was able to talk with her for the first time in 20 years about his deeper feelings and what he was working through in the intensive. And a lot of positive affirmation coming back from the spouse during that week. She's so relieved. She seems so much happier that I'm doing the work. She's 100% behind it, and very relieved that some of these things that have been troubling them as a couple in talking together, his ability to be open with her, talk about his feelings in really calm and really centered ways, were being accomplished for them, even though he was the one doing all the work. So it's very gratifying to hear such results for the individual and for their partners as well.
is there anything else that you would share with me or that you think would be helpful for me to know that I haven't explored?
Well, there was one more intervention that I integrate with EMDR and image transformation, and that's internal family systems. I use a very simplified model, and it helps an individual understand who from their internal family systems is receiving a message or speaking from that part of themselves. The simplified model that I like to use is used by Janina Fisher and Terry Real, both well-known published authors, is the wounded child, the things that happen to us in early life, the teenage self, the one who is committed to identity and justice and rightness and tries really hard to act like an adult, but they can't quite do it. And then there's the maturing self, that centered adult that really needs to be the one that's kind of running the show, or as I like to say, is driving the bus. But there are lots of times when that wounded child or that adolescent self kind of jumps into the driver's seat and is steering the bus. And that's a lot of times when things go wrong. But being able to integrate the work, when someone will explain a behavior, I will ask them, okay, so listen to that voice, say it to me again in just that way. Who's speaking from in that way? Who really registered that? And it helps them integrate the work. I want to conclude on image transformation is that it's very, very useful tool to integrate the trauma work in order so that when people re-enter their lives after the intensives, they have a greater sense of what part of the self is operating at any given time. And it really helps self-talk, because they can hear perhaps a really negative teenager who's kind of bought in to the parents' negative view of them. And then the maturing adult can really have this kind of discussion and validate the feelings of the teenage self, at the same time redirecting them to a deeper level of understanding. So there's a sense making, a storytelling inside that corrects the life path and the life trajectory. So, and it also, one more thing about that is that the wounded child also needs comfort. Well, the maturing adult can offer that once the client has really kind of caught the drift of this intervention and practices it, and is of course reinforced in their regular work. So that's the third one that's most common.
Great, thank you. I think you've answered all my questions.
Okay, well, good. Well, then I'd encourage you to go back and talk to your therapist if you feel you want to. If not, let me know if you need to think about it for a while, and I can make arrangements to get the consent forms sent to you, and we'll set a date and get started.
Thanks.
Okay, thanks for taking the time. Thanks for the good questions.